Ladies and gentlemen, welcome back to the Build Your Base podcast. I am super happy today to welcome back Bangkok nutritionist, Dr. Priya Khorana. Thank you for coming back onto the podcast, Priya.
Thanks for having me, Jack. Always a pleasure.
So if you want to learn a little bit more about Priya's story, you can go back to our last episode, which was on how to eat well in Bangkok. Today, we are talking about the current situation that we find ourselves in, which is COVID-19. There's a lot of talk about staying healthy, keeping a strong immune system, the importance of training, nutrition, lifestyle, everything else. So you are the perfect person to talk about the nutrition side of that. We hear a lot of people talking about immune system and it being strong. What does having a strong immune system mean?
Basically, what it means is that you are able and ready to fight off infection. And the big misconception now is that people choose and want to boost their immune system. So boosting your immune system is actually not the goal. Staying healthy, you need your immune system to attack the harmful bacteria and the virus and the abnormal cells, basically. Having a healthy immune system is key to fight off any infection.
And so what role does nutrition play in improving the ability of your body to fight off disease?
Unfortunately, right now, there is inconclusive evidence to suggest that anything can support and strengthen. Having a well-rounded, good lifestyle is the key. Nutrition plays an important role, as does sleep management, as does stress management, as does not smoking, as does moderation in alcohol. So it's all a big, well-rounded approach. Nutrition at the moment is the in thing. And what I do suggest to all of my clients and patients is that they need to basically go more plant-based. And the reason being is that foods that are plant-focused are high in anti-inflammatories and basically fight off free radicals. And free radicals is basically what causes disease and your body to fight against itself. Some of the foods that I will suggest are, leafy greens, berries, any and all fruits and vegetables in all colors and varieties, cruciferous vegetables, cauliflower, broccoli, omega-3s, nuts, walnuts, salmon, avocado, essential oils like extra virgin olive oil that I mentioned in my last podcast. So all of it does play a role, but it's about consistency and it's about maintaining a healthy lifestyle that keeps you fighting throughout. So it's not just I'm worried about getting coronavirus, so I'm going to start eating healthy for the next 5 weeks. It should really be ingrained in all of our minds to make sure that we maintain eating healthy 80% of the time anyway. And that is with, plant-focused foods, high fiber, gut health foods. It is important to make sure that you do live a healthy lifestyle.
Why is it that this evidence is inconclusive? Like, what's the difficulty in collecting evidence to show that, nutrition and certain factors on lifestyle would boost your immune system?
So there's no such thing as boosting your immune system. Your immune system are your lungs, your kidneys, your liver, and your organs and your skin. So you can't have them work more efficiently. What you can do is boost or strengthen your ability to fight off the infection whilst everything else is working alongside. So it's very difficult to explain that in layman terms, I guess, but there is no science on that because it's very difficult to offer a sick person plant-based diet and watch them improve versus someone who's not sick, if that makes sense. So what they are finding with the coronavirus is that patients who are already at a higher risk for developing chronic disease, metabolic syndrome, are the ones that are unable to fight off corona to begin with. But when they are amped with vitamins, and at the moment, the only evidence, and it's very small, shows that vitamin C, vitamin D, magnesium, and zinc are helping these already ill patients fight it off better. There's nothing showing that they recover faster. It's that they're able to fight it off at their pace and hopefully, not succumb to it.
So the hope would be that you would be better at fighting off COVID-19 if you get it. It wouldn't prevent you from getting it or make it
No.
harder for you to get it or anything like that, right?
No, that's exactly right. That's exactly right. So it's not prevention. It's at the moment, it's treatment. But again, if you are eating well, exercising regularly, avoiding cigarettes and alcohol, sleeping enough, and managing your stress, you are essentially preventing yourself from getting any illness, not just the coronavirus. With the coronavirus, it's very difficult at the moment because symptoms are varied. They're also, dormant for 10 days is what they're finding. So it's in every patient, it presents itself slightly differently. So the treatment itself is, we have to leave it to the scientists and the healthcare workers. It's very dangerous and very difficult to support natural remedies that people are presenting that they claim cure people of the corona, which is a whole other topic in itself. But, if you do eat 5 servings of fruits and vegetables of all colors a day and get, and live a healthy lifestyle as to what I've presented before, then you are better off.
You've mentioned a few foods that we should be looking at and consuming more of. Any other ones that we haven't discussed or you haven't mentioned? And are there any that are proven to be especially good to fight against viruses?
I would say gut health foods. So fermented foods, sauerkraut, kimchi, kombucha, miso, kefir, probiotics, all because, essentially virus fighting, infection fighting warriors, as I would call them, are in the gut. So if you are protecting your microbiome, essentially everything else will function better. And actually an interesting point that I will make is that if you do support your gut and you have good gut health, that is actually showing scientifically to impact mental health. And especially now in these times, not only are people more aware of eating well, exercising, more, but also they're more aware of their mental health state. We're facing uncertainty and we're facing our own anxieties. So if you do eat well, and that encompasses, fruits and veggies and gut health foods alongside whole grains, lean proteins, omega-3s, etc., basically balanced diet, you're able to cope better in what's happening today.
I think anxiety, stress is something that's really hitting a lot of people now, right? As well as the virus. I think that is another concern that does run alongside it. So let's look at kind of the circumstances that people find themselves in now. They can't go and eat quite in the same way that they used to, can't go to restaurants, things like that. So how should people be eating during lockdown in terms of like preparing food, getting delivery? Like what tips do you have around that?
So the first thing that I would suggest is getting your groceries delivered. And what you do when you look out for purchasing groceries is to make sure that you have food in stock. So I would, get 2 loaves of whole grain bread as opposed to 1 like I did. And you can freeze one, buying whole grains in bulk. So quinoa, barley, riceberry, just having them in your pantry. I stock up on, herbs and spices at the moment because I'm trying to reduce the sodium and the salt, table salt intake, for everyone in my family. So I jazz it up with spices. Those are easily available, easy to store as well. They keep for long. It is difficult at the moment to always get fresh produce. Fortunately in Bangkok, it's not too bad as yet. So we have the luxury of getting fresh veggies every week. Canned options are fine. Again, with canned, I would look at the sodium content of them. And I always drain and rinse whatever I purchase in a can, whether it's tomatoes, whether it's beans, whether it's lentils. And then the other alternative that I do suggest is frozen. So I get berries that are frozen now. I get, frozen peas, frozen corn, etc., and have them all on hand, when I do need. So because it is becoming more difficult to go out and eat, my first line of defense is cooking at home. And I suggest that for everybody. If you do want your treat meal once a week, go for it. And again, it's being smart with where you order from. And then again, it's when you do get it delivered, make sure you throw away the packaging, wash your hands before you serve, etc. So these are all ways that people can protect themselves and their families.
Good tips there, Priya. Thank you. Finally, do you think after all of this, people will be paying more attention to their health, their fitness, and, their nutrition?
Absolutely. I think at the moment, people's health and well-being is at the forefront. So as an educator, it's extremely vital for me to make sure that the information out there is relevant and it is accurate. So because people are paying more attention to their health, they need to be provided with the right kind of information. So, I do appreciate you having me on your podcast, and I'm absolutely loving the series that you're dispelling for everyone. I hope this in turn helps everybody going through this to want to take care of themselves and their families better, not just for the next pandemic, but the one that we are going through right now. When you are fortunate enough to work from home and have access to being able to staying at home, I think it's smart that we take advantage of the time that we're given to actually in turn understand how to take care of ourselves better. So absolutely, people are paying more attention, but rightly so, and for the right reason.
What kind of misinformation are we seeing about nutrition? I guess there's already the one that we've touched on, which is the whole, this boosts your immune system. But is there anything else you've seen? You're like, yeah, that's nonsense.
So a lot of the holistic approaches to disease prevention, I wouldn't say that they are the wrong approach. I would just say that they need to be treated with caution. So unfortunately, natural remedies, essential oils, etc., there's no science to back them up. So when people do offer advice, the consumers need to make sure that they take the advice, with a pinch of salt, and make sure that they are living lives, making sure that they take care of themselves with actual good food, working out, avoiding cigarettes and alcohol, sleeping enough. There is misinformation out there on the natural remedies that can prevent and treat and cure COVID. I would be wary of people following them and then letting, everything else slip.
So just to be clear for the listeners then, essential oils does not cure COVID-19. Can you confirm that?
I can absolutely confirm that. Essential oils do not clear you and cure you of COVID-19.
That's a shame. It's not the cure we've been looking for. For me, as soon as I hear the word holistic, I always get a little bit suspicious. I think it's a good message. Just stick to the fundamentals, get those right, and that will improve your ability to fight these viruses off. Priya, thank you very much for your insights. It's been very useful and interesting to hear. Looking forward to sharing this with our listeners. Where can we find you and find out more about what you do?
So I have a website that's out at the moment, lifestylenutrition.coach. If you take a look at my website, all of my details are on there. Feel free to go onto my contact page. The links to all my social media handles are on there as well, Instagram, LinkedIn, Facebook. But I would be delighted to receive any and all messages from any of you. If you need any advice, I'd be happy to help. And I really appreciate tag teaming with Base here. So thank you for having me on, Jack.
Yeah, not at all. It's our pleasure, and it's always great to work with you to get out all this great information. I think it's an especially important time to get this out to the masses. So thank you again for joining us, Priya, and I will catch you soon.
Sounds good. Thanks, Jack.